having been a patient, it was very, you know, how should I say, reassuring, and I felt much more comfortable being able to choose my team to take care of me. I was able to choose everyone from my surgeon to my anesthesiologist to my oncologist, and you know, having a choice like that and having some control over my health is what I think all patients want. And not to have that, I think, as a patient, you already feel somewhat out of control in terms of not being able to make yourself better, but to have a little bit of control in being able to research and pick who you feel like is the best person to take care of you is just invaluable. And to not have that, I think, would be a real shame to not only myself, but everybody in the United States.
As an anesthesiologist, I see myself as probably one of the strongest patient advocates that anybody in medicine could be. Primarily because we tend to see people at times at the extremes of life. We see people when they're having their children and giving birth. We see people when they're struggling, trying to survive and maintain, whether it's from a critical illness, whether it's from a traumatic injury. So we are the patient's, you know, if you will, sometimes last line in terms of patient advocate. As a result, I think a lot of anesthesiologists have it, shall we say, in their nature to function, if you will, perhaps almost like, I guess a crude analogy would be like a lifeguard. You know, you go to a pool and you swim, and you send your children to the pool and you swim and they're safe, and you assume everybody's going to be safe because you look up on the stand and here's this guy who's trained to rescue somebody from, you know, the jaws of death, as it were, at the last minute. And anesthesiology provides that same sort of function. Anesthesiologists in other areas too provide similar sorts of functions, but in a little bit different arena. There's anesthesiologists who are specialists in pain management, and they provide a great deal of relief and comfort for patients who have terminal diseases, cancer and whatnot, that causes horrible, debilitating pain. And they have techniques and medications that they can provide for those patients. So I think those are very humane and very important ways that anesthesiologists function as patient advocates.
My primary job is to be the patient advocate, because if the patient is not prepared for surgery, then I would have to cancel that to make sure that they can go through the procedure safely and comfortably. And if there's any events that occur, then it's my job to troubleshoot those. It's almost like I equate it to what I call anesthesia airways. I'm really involved at the very beginning, which is induction, and at the end, which is an emergence, which is like takeoff and landing for an airplane. And in the middle, I can be on cruise control, but I better be ready for anything.
The thing that I like about anesthesia, I guess, is you take care of one patient intensely and completely for a relatively short period of time, but you are totally involved with their care and with keeping them alive. And whether it's a trauma victim that's bleeding out and you have to pump blood into them, or giving them drugs to maintain their blood pressure, help maintain heartbeat, all physiological functions, you know, we're constantly doing things like that. And that's what I like. I like being acutely involved with one person.
I think it's important that our people that trust their doctors and are able to trust that we're going to do the right thing for them and with them. That's why I'm excited about this foundation. I'm excited about the opportunity to help patients and doctors both bring to the government and to the discussion here of what's important to us. People ask me why I'm so involved with this, and it's not because I'm a doctor. It's because in about 5 or 10 years I'm going to be a patient using the system. And I wouldn't be surprised if in 5 or 10 years the system was very, very different. I just want to make sure that whatever differences are brought into it are still able to take care of my needs and still treat me like an individual and still give me the assurances that it's the best quality that I can get.